My name is Joshua Morel, and this is my straight catheter validation video. All right, come with me. I'm gonna check the chart first before I go in the patient's room. All right, today we are taking care of Mary Sanford, date of birth 11/12/98. She has no allergies. She is a full code, and she's a low falls risk. She is a 26-year-old female who just had a vaginal delivery for her first child 6 hours ago. She had some surgeries when she was younger, an appendectomy and wisdom teeth removal. She's currently on levothyroxine for her hypothyroidism. And as we scroll down the chart, everything looks good. Her heart rate and respirations are up a little bit, but that's totally fine because she did just give birth. She's grimacing with pain, all totally expected. And she has some pain in the perineal area from birth. But the physician orders ask that we do a straight cath now because she has not voided since giving birth. So now I'm gonna go in and check with the patient, and then I will begin the process. Provide privacy. Knock, knock.
Come on in.
Mary. How are you doing?
I'm doing well.
Awesome. Could I get your name and date of birth, please?
Mary Sanford, 11/12/98.
Perfect. And then here's the wristband. How are you doing after giving birth? Have you gotten to see your baby yet?
I'm a little sore, and I have. It was kind of nice to see them.
Good. Awesome. Well, I'm here because your provider ordered a straight catheter. Do you know what that's for?
I think so.
Okay. Cool.
Can you tell me, though?
Obviously, I would love to tell you. So we're going to do a straight catheter because right now you're holding on to some urine, which can be a problem. It can put you at risk for infections, or it's just not good for your bladder to hold that much urine. The last nurse who was on told me that the bladder scan said it's about 600 mils. So I'm in here now, and we're going to get that done with so that then we can get you to void, and then ideally in the next few hours here, then you can begin to void on your own, and we don't have to do this again. How's that sound?
Sounds good.
Cool. Do you have any allergies?
No.
Perfect.
Thank you.
And then I am going to need to uncover you. Is that okay?
Yes.
Okay, perfect. And I'll try to be quick with how I do that.
Yeah.
So I'm going to raise it. Where is it? Yes. Oh boy. Just putting in work. Let save my back one day.
Save your back, but work your legs.
Come on. Beautiful. Okay. So I'll do some hand hygiene. And just so you know, any time that we're doing a catheterization, it does increase the risk for UTIs because things aren't supposed to go in that hole, so your body doesn't necessarily super happy when anything goes in there. Is it okay if I uncover this top part?
Yes, of course.
Can I pull up your gown? Sorry.
Yeah.
Perfect. All right. And then are you comfortable? I know you have a little bit of pain, but are you able to get into a froggy pose?
Absolutely.
Perfect. Cool. Awesome. And we'll try to be gentle here. Cool. Okay. So I have the straight cath. Let's do this. So this will be the garbage bag. I like that right there. That's great. Okay. So come off. And without touching anything on the inside, so I don't contaminate it. So that's there. And then I like the idea of holding onto this so that I can see the size of the catheter for when I'm documenting, so I'll put that over there. And now let's move this for the patient. Still not touching any of the inside parts. And then now let's do gloving. So here. Making sure to not touch anything within the 1-inch border margins. touch the inside of the first glove. Now ideally, this glove will go on and we don't have to worry about it. Perfect. We always start dominant glove first.
Sir.
Dominant glove first. All right, Mary, and then also, I forgot to mention this the first time, but because doing this does put you at an increased risk for UTIs, we're gonna want you to increase your fluid intake to continue to keep flushing those things out. And then we're gonna continue to document how your urine looks and the volume so that we can make sure that we're keeping on top of some of those things. All right, normally I would use lubricant, but because this is a mannequin, I don't wanna use lubricant on the mannequin, so I'll just be vocalizing when I would use it. But I'm gonna set it in here. Okay, maintaining my hands above my hips, or my waist and below my shoulders. I'm going to first thing. And we'll need to go shiny side down. Oh, this one's sticky. Perfect. Second one, without bumping the edges. Touch or contaminate anything. Okay, so now I have my 3 cleansing. Okay, and then now would be the time when I would lubricate the catheter. So I could lift it up and just, while maintaining my sterile field, I could just lubricate in here. Okay, so now I'm going to clean off the area. Before though, we would have done pericare, which could have been delegated to the CNA. So now all I have to do is just apply the iodine so that we're not introducing more pathogens into the urinary tract. All right, Mary, this might be a little cold, and I'm going to work away from my body first, and then without going over the sterile field. And we'll do inside, around, and right down the middle. All right, so this hand is dirty, so it can't move. However, so I'm gonna have to try to juggle this with one hand. Good thing I shouldn't be too difficult. Hello, come on. Okay, maybe we'll try that again. There we go. Much better. All right. So Mary, we're gonna do, for female catheterization, it'll be about 2 to 3 inches, and then, or until we see urine, and then we'll go another inch or so in, and then for males it would be 7 to 9 inches. Okay, so oh, perfect. And there's urine. And then I have to scooch this a little closer. Okay, and perfect. There we go. So then, yes. So now, good job, we voided, and then we can remove, and then, yes. Out, and this is garbage, so we'll move this, and we'll cover you right back up, Mary, don't worry. There, and this. Garbage, and we'll get you covered up. go. Okay, so now hygiene, and we'll document. So we'll note that there was 600 milliliters of output. Okay. So now what I would document is that there was approximately 600 milliliters of clear yellow urine for the output, and we used a 14 French straight catheter. There was no pain, well, there was maybe a little discomfort, but there was no extreme pain or discomfort with the procedure, and there was nothing to contact the provider about. However, we would if there was anything like blood or other abnormalities about the urine or a strong smell. There was no smell. Perfect. My name is Josh.